সুপ্রিয় দর্শক সবাইকে স্বাগত জানাচ্ছি বৈশাখী টেলিভিশনের স্টুডিও থেকে নিয়মিত সম্প্রচারিত স্বাস্থ্য বিষয়ক অনুষ্ঠান ইবনে সিনা ট্রাস্ট নিবেদিত সরাসরি ডাক্তারের আজকের পর্বে পুরোটা সময় জুড়ে আপনাদের সাথে আছি আমি ডাক্তার জান্নাতুল ফেরদৌস বৃষ্টি। দর্শক, এখন নভেম্বর মাসটির মেডিকেল সাইডের একটা গুরুত্ব এবং তাৎপর্য রয়েছে, আর তা হচ্ছে এটি লাং ক্যান্সার অ্যাওয়ারনেস মাস। আপনারা বুঝতে পারছেন লাং ক্যান্সার কিন্তু ভীষণ ভয়াবহ একটা ব্যাপার। বর্তমান গবেষণা বা চিকিৎসকরা বলছেন এটির পরিমাণ দিন দিন বাংলাদেশে বেড়ে চলেছে। তাই এই বিষয়টা সম্পর্কে আপনাদেরকে একটু বিশেষভাবে অ্যাওয়ার করব। আর তাই আজকে দুজন সম্মানিত অতিথি আছেন আমাদের সাথে, যারা মালয়েশিয়া থেকে আমাদের সাথে এসে অংশগ্রহণ করেছেন এই বিষয়টা সম্পর্কে আপনাদেরকে অ্যাওয়ার করতে। কারা আছেন আমাদের সাথে একটু সংক্ষিপ্ত পরিচয় দিচ্ছি আপনাদের মাঝে। আমাদের সাথে আছেন ডক্টর জর্জ, যিনি কনসালটেন্ট জেনারেল এবং থোরাসিক সার্জন, এবং আমাদের সাথে আরও আছেন ভিনসেন্ট ওয়ান, যিনি ডিরেক্টর কমার্শিয়াল প্রিন্স কোর্ট মেডিকেল সেন্টার। দর্শক, অতিথিদের কাছে আপনাদেরকে নিয়ে যাব, অর্থাৎ আজকে আমরা যে বিষয়টা নিয়ে কথা বলবো সেটা হচ্ছে থোরাসিক সার্জারি এবং মালয়েশিয়ান হেলথ কেয়ার সিস্টেম। এই বিষয়টিতে পুরোটা সময় জুড়ে আপনারা আমাদের সাথেই থাকবেন এই প্রত্যাশা কামনা করছি। Hello, Dr. George and Vincent Wan. Welcome to our show.
Hello, Dr. Rain. How are you?
I'm good. You?
Good.
Thanks a lot.
What's your feeling coming Bangladesh?
It's a good feeling because, you know, my origin is from India, basically.
Oh.
So it's more quite similar. And, you know, the people are very warm and the food is very nice.
So you are from India, right?
Malaysian, but our roots are from India.
It's my pleasure having having you and you in my show, because this show is a very popular show in our country, and we are discussing so many topics in this show for my viewers, and my viewers will be glad to have you in my show, I think. So I want to first ask, I'd like to know from Mr. Vincent, can you please tell me about the Malaysian healthcare system? As far I know, the Malaysian healthcare system is very developing day by day.
Thank you very much, Dr. Rain. Thank you, Bangladesh, for having us here.
Welcome.
I think before I go further into the Malaysian healthcare, maybe just to give a very overview outlook about Malaysia. You know, Malaysia is a country where we have a total of 11 states and 2 federal territory. We have a population of 30 million. And our races there comprises of the Chinese, the Malay, and also the Indian. And also we have some small minority of the native here. And in Malaysia here is a developed country. Yeah. It's a developed country, and in year 2020, Malaysia is promoting Visit Malaysia year. So to all my Bangladesh friends here, please come to Malaysia for holiday. So on top of that, of course, the medical tourism also is very popular in Malaysia.
Of course, as far I know, the Bangladeshi people like Malaysia for travel and for treatment like this. So I want to ask Mr. John, can you please tell me your brief introduction for our viewers, because I want to introduce you before the discussion.
Yes. So first and foremost, thank you very much for having us here in this TV program.
Welcome.
Yeah, so basically my name is George. I'm actually a consultant general and a thoracic surgeon, hailing from Malaysia and currently working in Prince Court Medical Center as a full-time surgeon there. So a lot of people will be wondering what exactly is thoracic surgery.
Okay. Yeah. Then if people want to get you for the thoracic surgery, they have to go to the Prince Court Medical Center,
yes,
right?
Exactly.
Okay.
Yes.
Then I want to ask Mr. Vincent, why people around the world come to Malaysia? Why not Bangladesh? Why people come to Malaysia for healthcare?
I think that's a very good question. Malaysia is a developed country where the healthcare system in Malaysia at the moment is at the top notch.
Okay.
So what happened here is, number one, I think we're looking into Malaysia as the halal hub.
Okay.
Yeah, it's a halal hub. And
it's good for the Muslim. Okay.
Yeah, it's good for the Muslim, halal hub. And also the hospital that we have, that is Prince Court, we are a international standard hospital. World-class quality hospital they're having here.
And can I know about the expenses of that hospital?
Well,
what type of expenses there?
The charges in Malaysia, all the private hospital are gazetted, and there is a capping. There's a capping of charges under the Malaysia Medical Association 13 schedule, meaning to say that there is a cost containment. There's a cost containment. For example, say you go to any other country, if you go to the senior doctors, then the charges will be higher compared to a junior doctor will be lower. However, if in Malaysia, irregardless whether you are senior doctor or junior doctor, the costs were within the containment.
Doctor, I want to know about the thoracic surgery. What is thoracic surgery?
Yeah, surely. So thoracic surgery is actually a surgical field in medicine where we actually deal with all the diseases of the chest. So starting from your neck below up to your breathing muscle, which is called diaphragm. So what we deal is, for example, diseases of the lungs, diseases of our foot passage, which is we call it as esophagus. Diseases pertaining to our rib, which protects our internal organs of the chest. We also deal with patients having a lot of problem with excessive sweating, which we call it as hyperhidrosis. So it is not a new field. It has been there many decades ago, but getting more popular now because a lot of people know and hears about thoracic surgery from social media, like what we are doing now, TV programs, which I think is very beneficial for a lot of patients out there.
People know about the thoracic surgery, but they don't know why thoracic surgeon and when thoracic surgeon. So I want to ask you, when to see a thoracic surgeon?
Yes. So as I told you earlier, when a person is having, for example, chronic cough, they have seen many doctors, many outside private clinics, taken medicines.
Chronic coughs for how many days?
Chronic cough can be weeks, can be months.
Can be weeks, can be months.
Can be months. And they have taken a lot of medication and still not healing them. The cough is persisting. Some people have even blood coming out in their phlegm. So then the main worry is either they're having some cancer or some infections like tuberculosis. So these are the patients that actually can come to a thoracic surgeon where we will investigate further and provide the necessary treatment. Another group of people is whoever having a lot of excessive sweatiness. Now this is a big problem among a wide variety of people where they do not know exactly there's a treatment going on. So what we can offer is that we can offer some remedy to these patients.
Doctor, I want to share information with you that is very, that I am very sorry to say that most of the people in our country are going to take the antibiotic without any prescription, without any consultation. That is very sad. What do you think about this topic?
Correct. I mean, I'm not really surprised with that question because even in our country, in Malaysia, a lot of people do the same thing. A lot of patients try to become doctors themselves. That is where the problem comes. They try to self-treat, self-medicate. Then what happens? If you have an early disease, you are actually letting it go, and instead of treating at early stage, you come at the last stage. So then we can't really do anything much except give him tender loving care, some pain relief.
Then early diagnosis is early treatment.
Exactly.
So early diagnosis is very important, and people have to understand that if I have any cough for a few weeks and have blood, then I have to go to the thoracic surgeon, right? So I want to ask you a question that when I search for the Malaysian healthcare system, I always find the PCMC. But what is PCMC? Every people know about the PCMC more or less, but I want to know from you the details.
PCMC stands for Prince Court Medical Center. This is where the hospital, Dr. George and myself, we are attached to. So this hospital is located 5 minutes from Bukit Bintang, or rather 5 minutes from the KL Twin Tower. So it's very near to these two destinations where is the shopping paradise for the ladies. So usually our patients, you know,
so
when the husband...
good hospital for the ladies
yeah, I think the healthcare landscape today, we must look into not only on curative, but also on preventive. That's very important here. So many of our patients come from all over the world. They come and do screening in the hospital. And after screening, the husband and wife or the couples, they will just go for shopping.
Then if I want to know the treatment standard level, is it international standard or what do you think?
We are international standard.
Okay.
And all of our doctors are graduated, most of them are from UK, US and also Australia.
So, doctor, I want to ask you a very personal question. What do you like most about being a specialist in thoracic surgery?
What do I like most is the challenges that we have to take dealing with complex and critical surgeries in thoracic surgery.
And also the breathing. Breathing is important for every person, I think.
Yeah.
Yeah.
The thing is about thoracic surgery is the disease might seem same, but the surgery is very complex and different. Yeah, even in lung cancer, there is no one lung cancer which is same.
I want to go to the lung cancer because lung cancer is very common in our country for the tobacco and smoking. So I will know the details, but I have to go for a short break.
No problem.
দর্শক আপনারা লাং ক্যান্সার নিয়ে অনেক কিছু শুনছেন এবং আমরা লাং ক্যান্সারের পাশাপাশি যারা মালয়েশিয়ান হেলথ কেয়ার সিস্টেমে ইন্টারেস্টেড আছেন তাদের জন্য মালয়েশিয়ান হেলথ কেয়ার সিস্টেমটা সম্পর্কে তুলে ধরার চেষ্টা করছি। সো ডক্টর জর্জ, before going to the break, I promised to my viewers that I will talk about the lung cancer.
Sure.
They are waiting for your speech that what is lung cancer, why it is lung cancer, and what is the treatment and diagnosis, each and everything.
Yeah. So lung cancer is cancer originating in any part of the airway, including the lungs.
Okay.
So it doesn't mean that the cancer has to be in the lung, even in the airway, anywhere in the breathing tract. So the common cause of lung cancer worldwide is smoking. So you see in every corner you see everyone is holding a cigarette. So tobacco kills.
Okay.
You know, government is doing a lot of anti-tobacco campaign, but still there is the awareness is there, but I think people are not taking it seriously. So common risk factors for lung cancer is actually number one is smoking.
Okay.
Number two is our environmental pollution because a lot of high-end industries are coming up. Yeah. Then you have asbestos.
We don't get enough fresh oxygen, right?
We don't really get, because it's polluted. You got asbestos in the ceiling causing asbestos-related lung cancers, which is very common in Australia. It is called mesothelioma. Then you have this cooking using the older charcoals in the rurals where they blow into the charcoal with fires where you get constant fume from the charcoal coming into the ladies who's having, constant exposure causing lung cancers as well.
Okay, doctor, I know most of the people in our country are smoker, but they all have a very common question that I smoke 10 years back, but I don't have any problem. So why you are talking me that I am going to face a lung cancer? Why?
Nobody will agree that they will actually fall sick. You see, everybody thinks that they are superhero. Yeah, they are always immune. Nothing will happen to them. Smoking about 10 years, you won't see the effect now. You give it yourself another 10 years. Give the time for the cancer cells to mutate. And probably by the time you reach 50s, 60s, then you will see changes in the lung. Okay, you can see tumors growing. So lung cancer doesn't develop over days. It actually develops over the years.
It can happen any time.
Yeah, it will happen. It's like a time bomb in smokers.
Okay, then I want to go to the very important topic, that is impact of smoking cessation before resection of lung cancer.
Yes.
What do you think?
So we always emphasize every lung cancer patients who are smokers to stop smoking, if it's possible, at least 1.5 months before we actually do the surgery. But some smokers are very adamant. It's not easy to tell
crazy
them.
About
they might even smoke 1 day before the surgery.
Okay.
So we can't do anything much. So that happens in Malaysia, quite common. Even when I was actually working in Liverpool, the patients are going for lung cancer surgery today. They will even smoke until 1 day before the surgery.
Okay.
So the thing is, the importance of stopping smoking is so that your cilia that have in your airway can regenerate so that you can actually push out all the phlegms. Otherwise, you produce a lot of phlegms after the surgery and you will basically drown.
Post-operative complication can arise, right?
Yes, yes. You can get lung infections because you cannot actually bring out the phlegm. So that is the importance of actually stop smoking. If possible, at least minimum 2 weeks.
Why do never smokers get lung cancer?
That's a very good question and a very confusing topic.
Okay.
All right. Smokers getting lung cancer, there is a good reason. Now, never smoker getting lung cancer is actually very sad.
Okay.
Now, never smokers getting lung cancer is actually a different clinical entity. You know, that is, you can say maybe there is a bit of smoking going in from secondary smoking. You got a bit of pollution going in, but the main entity in never smokers are actually genetic problems. You have genetic mutation in certain genes in your body,
Okay.
which is getting mutated, causing lung cancers. So there's a lot of genes in our body. For example, we call it EGFR.
Okay.
It's epithelial growth factor receptors.
Can it be genetic or
Mostly a
something
genetic
like
mutation problem.
fast blood? If the fast blood
Yes.
person
That-
have the lung cancer, then
You can have
Okay.
that, but sometimes you can have skip generations.
Okay.
You might not get immediate, but you can have one generation skipped. Yeah, so it's definitely related to genetic problems. It's about 20% people who are never smokers get lung cancers. It's actually quite alarming as well. Smokers get another cell type called squamous cell. So it's a two different types of cells in smokers and in never smokers. So the treatment difference.
Okay. Nowadays, our young generation, people are taking the e-cigarette or vape, like this type of smoking type cigarette. So they think that they don't have any problem. They will not face any lung cancer or something like that. What do you think about this type of smoking?
Yes, unfortunately, they are all wrong. Okay, we have seen there are already 1 or 2 published cases having not lung cancer, but severe lung injury after vaping.
Okay.
Because vaping is solution. Tobacco is actually,
So it is also harmful for the.
it's very harmful because
lung.
you are directly inhale the end product.
Okay.
And you get lung injury, you get severe pneumonitis, and you will never know now. Give it some time, probably another 10 years, and then the data will definitely come out showing that vaping causes lung cancer.
I think after this discussion, the young generation will understand this matter.
Hopefully.
So I want to go to the another very important topic, that is pulmonary tuberculosis, and this is very common in our country. So what do you think? What is pulmonary tuberculosis, and what is the reason behind it? What is the treatment?
Okay.
Everything.
Now, pulmonary tuberculosis actually is a bacterial infection in the lungs caused by this bacteria known as Mycobacterium tuberculosis. It is airborne disease, and if you come into direct contact with another person who's having tuberculosis, knowingly or unknowingly, you will definitely get the bacteria coming into your body. Pulmonary tuberculosis is a great mimicker of lung cancer.
Okay.
So some people might think that they're having lung cancer, but actually they might be having tuberculosis, and it's vice versa. Sometimes you treat a patient for pulmonary tuberculosis, but there is actually cancer hiding it. So you actually, it's a bit difficult. The reason is because the symptoms are almost similar.
Okay.
Cough.
For the patient, the
Similar
symptoms are
symptom. Yeah,
almost
it's
similar. So-
dry cough. You have traces of blood coming in your phlegm.
Okay.
You have evening fever.
That we see
Yes.
in the lung cancer also, right?
Same,
Yeah.
almost similar. Loss of weight. So you can see that most of the symptoms are similar. It's just that pulmonary tuberculosis is a curable disease. You just have to drop in anti-tubercular tablets. You
That
don't-
drug.
Yeah, anti-tubercular tablets for about 4 months to 6 months, or maybe at the most 1.5 years, and you will be cured. So pulmonary tuberculosis is a treatable disease. We just want people to know and come forward. And how do we investigate? You can do a chest X-ray. A simple chest X-ray will see changes in the lungs. Sometimes you can have cavities in the lung, nodules in the lung. That will give a clue that this patient might be having a pulmonary tuberculosis.
Okay, Mr. Vincent, we have already come to know that your thoracic surgery department is very strong because Dr. George is there.
It is strong.
But I know PCMC is the multi-speciality hospital. So what about the other sectors or other departments?
You are right, Doctor. Prince Court Medical Center, we are a multidisciplinary hospital, general hospital, and apart from the thoracic cases that we are doing, we are also very good in terms of orthopedic and spine surgery.
Okay, spine surgery is very important.
Orthopedic and spine surgery. And if I were to rank top three that we have in Prince Court Medical Center, will be the first one is orthopedic, and the second will be women and children.
Okay.
And the third one will be the heart center. So these are the top three disciplines that in Prince Court Medical Center that we are very proud of.
Then I want to know what is the success rate of your surgeries?
It depends on what type of surgeries you are referring to. Of course, if you're talking about a common appendicitis, of course the success rate is almost 100%. You know?
Okay.
But of course, you're talking about coronary artery disease. You know, and again, it depends on the age factor. So, but as a whole, what I can share here is Prince Court Medical Center, our clinical outcomes are the gold standard.
Okay. So, what do you think? Why PCMC is specialized hospital, or why PCMC is better than others? What do you think?
We are very proud of here because the type of patients who seek treatment at Prince Court Medical Center is not only Malaysians. We have international patients from all over the world. We have patients who comes as far as Australia, as far as New Zealand they came. And they came from Australia mainly for plastic surgery. You'll be surprised of that. All the way they flew from the down under for plastic surgery at Prince Court Medical Center. We have patients all the way from Somalia who come for spine surgery.
Okay.
Yeah. So that is something that when we look into our patients' profiling, out of the 100%, 30% of our patients are international patients.
Thank you very much. We are almost at the end of the program.
Thank you very much, Doctor, for having us.
Thanks a lot.
Okay.
Thank you.
Thank you. দর্শক, এই ছিল আমাদের আজকের আলোচনা অনুষ্ঠানের একেবারে শেষ পর্যায়ে চলে এসেছি। এখন বিদায় নেব, তবে হ্যাঁ, আজকের আলোচনায় অর্থাৎ থোরাসিক সার্জারি নিয়ে যে আলোচনাগুলো আমরা করলাম এবং পিসিএমসি সম্পর্কে আপনারা নিশ্চয়ই এতক্ষণ অনেকটাই জেনে গেছেন। তবে হ্যাঁ, সব চিকিৎসকদের কিন্তু একটা ইনফরমেশন থাকে, সেটা হচ্ছে আপনার যে কোনো ধরনের সমস্যায় আপনি তৎক্ষণাৎ চিকিৎসকের পরামর্শ দেবেন। আজকের ডক্টর ঠিক এই বিষয়টা দিয়ে শেষ করছিলেন যে অ্যাজ আর্লি অ্যাজ পসিবল যে কোনো ধরনের সমস্যায় ডাক্তারের পরামর্শ নিন, কারণ আপনি যদি ভুল করেন বা আপনি যদি অপেক্ষা করেন, সেটা আপনার কিন্তু আপনার শরীরের বা আপনার মৃত্যুর কারণ হয়ে যেতে পারে। আমি চাই না আপনারা খারাপ থাকেন বা আমি চাই আপনারা ভালো থাকেন, আপনারা সুস্থ থাকেন। আর এই প্রত্যাশা কামনা করে আজ আমি এখানে বিদায় নিচ্ছি। আগামী পর্বে আবারও হাজির হব নতুন কোনো অতিথি নিয়ে, নতুন কোনো বিষয় নিয়ে। ততক্ষণ পর্যন্ত সবাই ভালো থাকবেন, সুস্থ থাকবেন, নিরাপদে থাকবেন, বৈশাখী টিভির সাথে থাকবেন। খোদা হাফেজ।